The information in this presentation applies to all MR systems, regardless of magnet field strength. MR uses a powerful magnet to create images of the interior of the body. Because the magnet is so powerful, certain precautions are needed. This video starts with a brief introduction to the magnetic field of MR systems. Then the potential hazards and the prevention of potential hazards are mentioned. Next, the contraindications that might pose a hazard to the patient are discussed, followed by the health aspects of static magnetic fields. The video concludes with a summary and a list of the appropriate safety precautions. Magnet Field Introduction. The magnetic field will attract objects made of steel or other ferromagnetic materials with enormous force. Even heavy objects can fly into the magnet. The magnetic field can also create torque forces on ferromagnetic objects, such as some implants, which may cause tissue damage. Although it cannot be seen or felt directly, the magnetic field of an MR system with a superconducting magnet is always on and must always be treated with respect. The main magnetic field generated by the magnet is not completely contained within the bore of the magnet. In fact, the magnetic field goes right to the edge of the room. All magnets are surrounded by a magnetic field, represented by the magnetic field lines. In a cylindrical system, the field lines are horizontal, but in an open system they are vertical. This means that the magnetic field around the magnet is different, creating different effects within the field. The limit of safety for ferromagnetic materials and magnetically sensitive devices, such as pacemakers, is known as the 5 Gauss line. For most sites, the 5 Gauss line lies just within the examination room. So it is advisable never to bring ferromagnetic objects into the examination room. Potential hazards. The magnetic field will pull ferromagnetic objects towards the magnet. In this way, a large metal object such as an oxygen tank or cleaning machine can become a missile. Small objects are pulled into the magnet at very high speeds, posing a significant risk. Even a spoon or coins can be dangerous. The magnetic field also twists ferromagnetic objects into line with the direction of the magnetic field lines. The twisting or torque forces can be dangerous in patients with ferromagnetic implants, because this force can displace the implant, tearing tissue or rupturing blood vessels. Brain aneurysm clips are particularly at risk from this effect. The magnetic force increases rapidly as you get closer to the system. If we hold an object a few meters from the magnet, we might feel little force, but closer to the magnet, the forces are substantially higher. This effect is even greater in the case of the actively shielded magnets. These forces are generally higher in the case of open systems, even when the magnetic field is lower than that of a cylindrical system, due to the different design of the magnet. Scanning a patient at field strengths above 2 Tesla represents a proportionately higher risk, requiring additional attention to the patient. The magnetic field can also affect the operation of magnetically sensitive active implants, such as pacemakers. And remember that the magnetic field can damage watches and erase magnetic data carriers, including credit cards. Preventing potential hazards. To keep your MR suite safe, follow these simple precautions. Post warning signs to alert everyone about to enter the restricted area of the MR suite. All personnel must know the location of the 5 Gauss line. Screen everyone who enters the MR suite and make sure they follow the MR safety guidelines for their own safety and the safety of others. Remember that these guidelines are not only for patients and medical staff, but also for cleaners, service engineers, medical and non-medical emergency personnel, including firefighters, and anyone else who might possibly enter the MR suite. Screen everyone for ferromagnetic objects in their bodies, such as implants, bullets, and shrapnel. And screen everyone for metal on or attached to their bodies, such as hairpins, brassieres, buttons, zippers, jewelry, and body piercings. Even makeup and tattoos can contain ferromagnetic material. Remove all makeup and be alert to the possibility of irritation in tattoos. Ensure that patients wear hospital gowns without metallic fasteners. Patients' ordinary clothing can contain magnetic objects or threads that may pose a hazard in the MR environment. Any equipment brought into the MR suite must be made of a non-ferromagnetic material and approved for use in an MR suite. The tools used by service engineers must also be made of special non-magnetic material. Note that equipment or tools which have been approved for use with magnets of up to 1.5 Tesla may no longer be suitable for use at 3 Tesla because of the higher forces at this field strength. Some common items that must never be taken into the MRI scan room include pulse oximeters, clipboards, stethoscopes, scissors, pagers, and pens. In an emergency, press the quench button. This will switch off the magnetic field within about 20 seconds. This must only be done in the case of a real emergency, when switching off the magnet is urgently needed. Bringing the magnet back on field is a very expensive and time-consuming procedure. Contraindications. Contraindications are conditions that might pose a hazard to the patient. They must be assessed by a qualified person prior to the examination. Ferromagnetic implants, such as aneurysm clips, and electronically active or passive implants, such as pacemakers and deep brain stimulators, are in principle contraindications for MR scanning. There is also a risk in scanning patients who may have embedded metal fragments in or near the eye. Machine tool operators, metal workers, and welders should be given an X-ray examination to detect the presence of any metal particles. Pregnant patients can be scanned when absolutely necessary. This is a matter of clinical judgment. If pregnant patients are scanned, they are scanned at magnetic fields of 1.5 Tesla or below, at reduced SAR levels, and not during the first 3 months of pregnancy. Health aspects. Since the introduction of MRI scanners in clinical practice in the mid-1980s, some 500 million patients have been scanned. Most of these examinations have been performed with 1.5 Tesla systems. No long-term negative health effects directly related to the static magnetic field have ever been reported. Summary. The magnetic fields around modern MR scanners are becoming increasingly stronger. Extra safety precautions are therefore essential and should never be forgotten. Remember the following points. The magnetic field around the magnet is always on. The magnetic force increases rapidly close to the scanner. All personnel must know the location of the 5 Gauss line. Never bring ferromagnetic objects within the 5 Gauss line area. All equipment in the MR suite must be certified as MR safe. Warning signs must be clearly posted. All persons must be screened before entering the MR suite. Have any contraindications assessed by an appropriately qualified person. Only use the quench button in a real emergency. This video highlights some of the basic guidelines for safe operation of an MR system. It does not give a comprehensive list of all possible hazards. In addition to this, you must read and understand the chapter on safety in the instructions for use of the MR system. If issues are not clear, please contact your local physicist or applications specialist. Provided that the appropriate safety precautions are observed, MRI is an inherently safe modality producing images of outstanding clinical value.